All right, thanks everybody for joining us for another episode of Health Matters. And today we're joined once again by Dr. Dev Sangvai, the Secretary of the Department of Health and Human Services, talking about a couple different things. A major transformation in how the state supports vulnerable children with something called Path NC. It's a groundbreaking new system to improve outcomes for children in the welfare system. We're going to talk about some old topics that we talk about every time it gets hot. We're talking about summer safety
Oh
tips
yeah.
and also the uncertain future of Healthy Opportunities Pilots. That's a program that addresses social needs of healthcare and may soon face some funding challenges. So first off, Dr. Sangvai, thank you so much for being with us once again today. We
Great
appreciate
to be
that.
here, Rod. Yep.
So let's start with Path and See. Full transparency. This will probably air after you guys do your launch. So tell
Okay.
us what that is and why it's a significant step in North Carolina.
Yeah. So in North Carolina, we've got a child welfare system that's administered by the state, but it's really run by the county Department of Social Service agencies. And so the state provides some guidance, but it's really run locally. And up until now, most of that work that has been done really to understand who are the children in the foster care system, who are the children coming in out of DSS programs, has been done at a very county centric model. And depending on what sort of resources the county had, sometimes it was done on paper, other times they were using different forms of electronic means of communication. One of the limitations was that you couldn't get communication between counties. So you could literally have neighboring counties not know who are the kids that are in the system in the county. And we know that either for services, whether it's healthcare, whether it's social services and other things, kids are going to go from county to county. And what we wouldn't have a line of sight to is exactly who those children are and what type of services they were using. And inevitably, what you have in these type of situations, as you know, is some kids fall through the cracks. And we would have situations where there wasn't good awareness or there wasn't good line of sight between what was happening in one county versus happening in another county. Well, PathNC is going to change all that because it's a uniform platform for doing all the intakes across all 100 counties. So now all 100 counties will have a standardized way of doing the intake when a child enters the system and documenting that intake. And importantly, it'll be visible across all other 99 counties. So now we've overcome one of the biggest hurdles, or two biggest hurdles, is a uniform system of documentation, electronic, as well as a way for that information to be available among counties. So this is a huge way to be able to understand who's in the system. And then finally, it's just not knowing who's in the system, but what's happening to them. And so the case by case, the case management systems are also going to be documented in PathNC. So what we will have at steady state, we launched just earlier this month, and like most IT platforms, it's a slow launch. We're going to go in waves, but what we're going to have is now really exciting. We're going to end up having the ability that once a child is in the system, it'll be visible across the entire state. Once an intervention has happened with that child of some sort, it'll be visible across the entire state. So what we've really done is modernize a system where we have significantly reduced the risk for a child falling in between the cracks when you have the fragmented system that we previously had.
It's interesting because the general layperson would say, "Wow, I thought that probably should have already been happening." But I
Sure.
think many people would be surprised. The other states have the same issue. The state I lived in before here for many years had this same problem, and we saw some kids who did fall through the cracks, but you didn't even know
Right.
about it until something major happened. Are we far in advance of some other states, or is this still a problem across the rest of the country?
As far as I understand it, it's mixed. There's some states who have launched similar platforms like we do, and they're a little bit more organized. We're one of only 10 states where we have this unique model where we're state supervised but county run. And I imagine that creates a little bit more complexity versus a state where all the county agencies are actually run by the state. So I think we're now keeping up with the pack. I think what we're going to now have is ability to take a more of a leadership role once we get to steady state, because we'll be able to do the documenting and the data and analysis as well, which will help us understand what are the needs of the kids. Are we meeting those needs? Where are the needs the greatest so we can shift some of the resources that we have available? So right now, I feel like we're keeping pace, but I'm optimistic that as many things in North Carolina, will soon become a leader.
I certainly don't want to bring up e-courts, but
Yeah.
many people will remember that e-courts, when it rolled out, had a lot of issues getting
Mhm.
everything online. How are you equipped to kind of avoid that kind of problem that going
Yeah.
down the line too?
Yeah, that's a great question. You learn from everyone else's mistakes and sometimes your own. So we're doing a couple things. First, we're doing a slow, very methodical rollout. Ultimately, this will be all 100 counties, but we're going slow and learning from steps along the way. We had a tremendous amount of planning on the front end as well, and really getting the feedback from the end user and asking how the social workers and other team members in the counties would like a platform to work. So that's always going to be helpful because there is that excitement to then use it. And then continuous feedback, making sure that we're taking the glitches out of the system as we get them. So far, as I've said, we've about 14 days into this, maybe 15 days, but I've already had hundreds of intakes and hundreds of notes that have been put to the system, a few glitches along the way that we're able to fix in pretty real time. So excited to see that at least that initial 2 to 3 weeks where you sometimes get the big bugs, we haven't identified any.
Yeah, and you get the buy-in, and that's hugely important. You
Huge.
got to make sure that the stakeholders are buying it. Talk a little bit more about the how it's going to improve the cases and how they're managed, and then how decisions are made when it comes to
Yeah.
it.
So on the front end, when you have an electronic medical system or electronic platform, whether it's medical or the type of what we have here, you're going to end up making it easier for individuals to do work. And so I think the first thing we're going to see is by modernizing the system, we're going to end up having more individuals interested in being a part of the team. Right now, many of our counties are struggling with a significant vacancy rate among many of the individuals who do these roles. And part of it is, I can imagine if you went to school and your previous jobs were all electronically based, you learned on computers, you did work on computers, it's hard to take a job where you're not doing the same. So I think what we're going to do is have better recruitment as well as retention because it's going to allow individuals to do their work in a uniform fashion. Our caseworkers are stretched and stretched thin. They're overworked in these settings. So we want to be careful that this is not a tool to get them to do more, but we hope that it'll allow them to do more efficiently so the output also increases simultaneously.
And all that data that you take in, how does that improve the health, the outcomes for children?
Yeah, well, tell us a couple things. As I said earlier, it's going to let us know what type of impact we're having. It's going to let us know what the needs are when we can start collating data. And if we find that there are some needs that we're not able to identify, it could be behavioral health, it could be food and nutrition, it could be other things. So it's going to allow us to identify what those needs are by being able to coalesce it across the entire state.
What can we expect when the rollout happens tomorrow? I mean, I know officially you guys are having an event tomorrow in Winston-Salem. What can we expect to hear at that event?
Well, I'm excited to go actually meet the people who are actually using the tool. And so we're going to be in Winston-Salem meeting in Forsyth County with the DSS team there. I want to hear how the tool is working, what sort of data they may already have. It won't be necessarily collated and collected the way the tool allow us to do. And then really kind of get a measure of the job satisfaction of the team members there, because again, they are working so hard to do so many different things. We want to make sure we're thinking about their wellness while we're thinking about the wellness of the children as well.
How long has this been in the planning for?
Several years. We've been fortunate that it's taken, while it has taken several years, we've been fortunate that we've been able to get line item funding from the General Assembly to move forward with something like this.
Yeah, budget costs. Can you estimate what it's going to cost this system once it's all said and done to get put in place?
I don't specifically know, Ron, but I'm happy to find that number, what it looks like. We think that at the end of the day, the expense is going to be well worth it simply because we're going to be able to avoid some of the challenges that we've had. Like many things we've done here at the state, we've been incredibly cautious about making sure we use the right partners, right vendors, only pay for the things that we need. Whenever you have software tools like this, it's natural for individuals to want more bells and whistles attached to them.
Yeah.
But we've been conscious about making sure that it has the right functionality for the right time, and then we'll kind of measure it as we go along.
Yeah, and then I mean, of course, you get the right system, then you can improve it later or add
That's
things
right.
as you may need it. Anything else you want to add about Path and C and how important this is, and in taking care of the kids in your system?
Yeah, I appreciate you asking. Right now is really just to thank people who had the foresight and the wisdom to put something like this together, the patience of individuals as we've had a small delays along the way, and then really want to say thank you again to all the people who are going to be end users because it's their feedback and their excitement that's allowed us to be equally excited about launching the program.
Awesome. All right, let's switch gears for just a second. Excuse me. I think this week the lowest temperature we're going to see is 90 degrees.
That's right.
And that does not factor in humidity, and we're talking 90 and maybe as high as 97, 98. Um,
Right.
Summer is here. That's a health risk for children. Talk about some of the things that you want to do to keep kids safe. I know there are a number of different areas we want to talk about. So we'll start, I guess, with like water safety. People often
Yeah,
forget how important that is.
yeah, absolutely. And I think it's particularly evident this week as, we're driving around town and you see the number of graduations that took place last weekend and maybe even a few into the early part of this week. So school is definitely out for the summer.
Yeah.
And as you said, it's a time to enjoy the outdoors. So, water safety, really important to make sure that individuals are conscious about beach safety, watching those rip currents, making sure that if you are going out into the water, you let individuals know that you're going. If you have small children who are out in the water, whether it's in the swimming pool or out on the beach or at the lake, really important to make sure that you always have eyes on the kids, because we know particularly with the beaches and even in other man-made and naturally occurring bodies of water, you have the reality that things can proceed pretty quickly. So having eyes on, knowing where individuals are is important. It's also important to remember that when you are swimming and out there, you're actually sweating and you're, getting dehydrated and you're losing water when you're swimming. Sometimes it's not perceptible. So staying hydrated, which we technically tends to be more of a how to have fun in the sun type of guidance, is equally important when you're out in the water.
What can parents and caregivers do right now to make sure that they are prepared for summer with kids out and about?
Yeah, most definitely. This goes back to what I said earlier. If the kids are in the water, eyes on the kids at all times, making sure they're not going beyond what their level of comfort is and what their level of capability is, whether it's swimming or even going out into the beaches and into the lakes or any other body of water. So eyes on kids at all times. As far as sun safety goes, sunscreen, incredibly important. Sometimes people will think, well, the sun's not out, and so I don't need sunscreen. Just because the sun's not out doesn't mean you don't need sunscreen. So staying with sunscreen on at all times with liberal application is going to be an important thing to ensure that you don't get sunburn or have more serious skin issues down the road. And then food, oftentimes we forget to talk about the importance of food safety. It's grilling season, it's picnic season. So whenever we talk about grilling season, make sure you cook your food thoroughly. Want to make sure that individuals are avoiding any kind of foodborne illness. If you've got fruits and vegetables, make sure you wash those thoroughly as well, just because we know that whether it's in transport or anything else, there's always the risk of things that you don't want to consume landing on fruits and vegetables.
Mhm.
And then making sure that you're not keeping things out in the sun that don't need to be out in the sun for too long. And I think you and I have discussed the importance of potato salad, macaroni salad, and all the other things that sometimes might have mayonnaise and other things on them. Got to keep them cool and out of the sun.
And it's so easy to forget when you're out having a good time and you just left the food sitting there that you're like, you probably should put that on ice or
Oh
put it in
yeah,
the fridge. Yeah.
yeah,
Um,
absolutely.
when it comes to others, not just children, but we're talking about heat safety. I always think of the most vulnerable in our community, the
Yeah.
seniors, and what is the health department doing to kind of address where seniors are and making sure that they're taken care of and understand the
Absolutely.
risks as
Yeah.
well.
Yeah, Rod, I really appreciate you asking that question, because oftentimes seniors aren't going to have the mobility to actually get outdoors. And if you are living in a situation where you are on fixed limited income, there are tendencies to manage the air conditioning in more judiciously. Or even if you don't have air conditioning, how do you ensure that you stay cool? Most importantly, if you are a senior, tap into your loved ones to make sure that they know that they should be able to reach out to you. And then if you are someone who's the loved one, friend, family member, neighbor of someone who's a senior who has maybe some mobility challenges, doesn't get out of the house much, check in on them. It's not only good advice during the summer, it's all good advice all the time, but particularly during these near triple digit heat indexes out there, it's really important to make sure that those individuals are checked in on. We offer fans through certain programs for seniors. So if we can get you a fan, sometimes that's helpful to help get the air to circulate. It's also important, even when you're indoors, to make sure you're getting good food and nutrition and to stay hydrated as well.
Yeah, it's a tough time for a lot of folks who can't afford air conditioning, who don't have it in their homes and that sort of thing.
Yeah.
Now, you guys have something that you recently launched called the Heat Health System, Health Alert System. What is that about? Tell me about that.
Yeah, that's a system to just make sure individuals are aware of when the heat is at a point where it can be dangerous, what to do, how to manage around that. And the guidance is pretty simple. If you're in a situation where there's a significant heat index, try to stay indoors, try to stay cool, go to near those bodies of water if you can. Again, managing all the safety that's important with that. Just being conscious about what's going on. I think as you've said, it's starting to get warmer now, and it's going to be warm for a while. So it's really important to just be conscious of those things.
And it kind of sneaks up on you too. You don't realize, that you're getting overheated until it's actually happening, right?
Exactly. Right.
Are there signs to look for that you can warn folks about with when it comes to heat exhaustion and kind of getting overheated? What do they look? What do you need to look out for?
Yeah, so I think exhaustion is a good term to use. So there's a whole spectrum of heat-related illnesses, and it's probably not as important to know what the specific diagnosis is. It's just number one, how do you prevent? So if
Yeah.
you are in areas of extreme heat, try to avoid those or limited exposure. Continue to stay hydrated. Water is always the best thing to stay hydrated with, but sometimes an electrolyte, including fluid, is a good idea too, like a Gatorade or any of the other things that are out there that are commercially available. Sipping is generally better than trying to take in big gulps at one time. And what I mean by that is you want to make sure that you're kind of staying hydrated throughout the day and not just trying to get all your hydration at one time and then not stay hydrated throughout the day. So those are good pieces of advice to kind of think about how you maintain this throughout the day, as opposed to just kind of doing it in limited periods of time.
I guess I never really thought about it though. I guess when you get really, really hot, your first instinct is to just take in as much water as you can, right?
Right.
But
Right.
sipping it just kind of makes it go a lot longer, a lot longer.
Yeah. It's kind of like
Um,
catching up for it. Yeah, exactly.
yeah, yeah. All right, Doc, we're going to take a quick break. We'll be back in a second and we're going to talk about the Health Opportunities Pilot. Welcome back, everyone. Thanks for sticking with us. I hope you listen to some of those tips when it comes to heat. We want to kind of switch subjects a little bit, shift gears, and talk about the Healthy Opportunities Pilots. And that's a program that's gained a lot of national attention for people who may not be familiar with what that is. Kind of walk us through a little bit about what that program is.
Yeah, Rod, I really appreciate you asking for this. And this is really something that has put North Carolina on the map. It's a fantastically innovative program that's really designed to ask and answer the burning question of, we all know we spend too much money on healthcare.
Mhm.
So is there a way that we can spend less money on healthcare while we're getting more health or getting better value for our healthcare dollar? So several years ago, a group of us in North Carolina proposed this idea that we know that individuals will oftentimes use healthcare services because they don't have access to food or they don't have access to transportation to get to the right healthcare provider at the right time. They may be dealing with issues with violence in the home, there's stress issues, behavioral health issues that need to be managed. What if we found a way to manage those on the front end so that the consequences of those not being managed would oftentimes become medical and more expensive? We can actually avoid that. So the idea is the best way to bring down healthcare costs is actually to spend less on healthcare. So that's what this concept was. So we launched this program in 33 counties. We call these the Healthy Opportunity Pilots. They've been in existence for a little over a year. And the idea was, when someone was identified with having a food insecurity issue or a transportation issue, we would use some of our Medicaid funding to help fund that, with an idea that by being able to keep people healthy, they could go to work, for example. By being able to keep people, have individuals have transportation, they can go see their primary care provider as opposed to go to the emergency room. It's a great idea. People have tried this for a long time period. Even in my former role as a hospital president, we thought, what if the hospital made investments in this? And individuals have always struggled, entities have struggled to say, how do you actually show that you can spend less money? Well, we did that in North Carolina. We actually showed that if you make the right investment for individuals to get access to transportation, to get that food that we talked about, to get counseling if you're dealing with interpersonal issues in a relationship, behavioral health, stress reduction, if you spend money on that on the front end,
Mhm.
you actually save money in a pretty short time period. In about a year, by investing in those, we can show that the average individual spends about $1,000 less on healthcare a year. So let's think about that for a minute. We're actually showing that we call that bending the cost curve. Everyone's saying the cost curve in healthcare is going higher. We can actually show that you can bend the cost curve by making those investments.
Mhm.
Um, and don't take just my word for it. We've had the Shep Center at UNC look at the data and say it makes sense. And it's even been published in what might be arguably one of the top medical journals, the Journal of the American Medical Association, that has shown that you can actually make these differences. We've had great experience from other states who want to say, hey, we want to replicate what you've been able to do. So these are the healthy opportunity pilots. We're really excited about the work that we've been able to show that we can do to spend less money on healthcare, keep people healthy, keep people active, let them go to work. When an individual goes to work, if they have kids in school, the kids can then go to school. It's got this huge economic impact as well, not just the healthcare impact that I outlined.
Yeah, it's a cyclical thing, and if you get in front of a problem, then it ain't a problem. If
Yeah,
you stop it from
exactly.
happening. So,
Yeah.
are we looking at this program at the risk of being shut down because of funding? Where are
Yeah,
we?
so yeah, that's the challenge. It's a pilot, and as we've had the House and the General Assembly and the Senate and the General Assembly both put forth their individual budgets, which is now in that conference period, neither of them had put money in to continue the ongoing support of healthy opportunities. However, since we've made that aware, and since we've made individuals aware that in the absence of funding, we'd have to shut this down by July 1, we've had significant and really genuine interest and dialogue with members of both parties in the General Assembly in both chambers to say, what can we do to ensure a program like this continues? So I'm going to remain optimistic that we find a way to continue this important work. And importantly, we've been able to show this progress in a year. Imagine what we can do in 2 years and 3 years.
Absolutely.
And we can actually say, if we want to spend less money on healthcare, let's just use less healthcare. And
Yeah.
this actually shows that you can do that.
And the way to do that is to prevent having to go there. How does this affect rural communities? Because I know that rural healthcare is a big issue.
Yeah. Well, it's particularly impactful in the rural communities because, as you know, everything that challenges healthcare is just more challenging in many of our rural counties and rural communities. And I saw this firsthand. So I had the opportunity to go visit Western North Carolina just last week and talk to some of the individuals who work as the agencies that provide some of these healthy opportunity resources, behavioral health resources, substance abuse resources, food in some cases, and even meet some of the individuals who receive these services is critical. One of the other pieces behind all of this is that we have relied on local entities to provide these services. So it's local farmers and local grocers, local retailers, sometimes the mom and pop shops that are actually providing the food boxes. So it's actually become a bit of an economic engine in North Carolina as well. I remember talking to one farmer in Western North Carolina who said, if the program goes away wholesale, he'd probably have to lay off 3 people who work on his farm.
Yeah, that's not good.
That's good.
And he
And that's
needs
just
it.
a one.
Right. He needs it. The people who you serve need it. It just seems like a
Absolutely.
win-win for everybody.
Yep.
So hopefully
Yep.
those good conversations continue, that dialogue continues. If there's anything the public can do to kind of help facilitate that, push it along.
Yeah, I think the best thing the public can do is continue to raise the awareness, raise the awareness in your communities and raise the awareness with your elected officials, others who have the ability to make those decisions in the early time period on how important this is.
Yeah. All right, Dr. Sangvai, thank you so much. Anything else you want to mention down the line of what we're talking about here, protecting kids, or anything you got going on that you guys want to preview, if you will?
Yeah, it's a busy time for us. Lots is happening here in Raleigh, lots happening in Washington. We continue on to, what I continue to want to focus on is when you're an agency as big as we are, there's a temptation to talk about 11 million people, the size of our budget, and so forth. But I firmly believe that the measure of an agency is the impact you can have on that one individual, whether
Absolutely.
that one individual is out there having fun in the sun, taking all the right precautions, enjoying many of the water things that you can do, taking all the right precautions. And if they happen to be beneficiaries of the many services we provide, understanding that we're out here advocating for you.
Yeah, and important to mention because I think we talked a lot about like lakes and rivers, but those home pools are a big deal too. People have got to watch out for their kids. Don't just
Oh,
let them
yeah.
run out there and play and not pay attention to them. And I think that parents get overwhelmed, so I don't presuppose what they're going through, but we
Yeah.
just want to remind everybody.
Yeah.
And I'll throw this out there too because it's not something you mentioned, but hot cars are a big issue. And I
Hmm.
know technology has changed a lot, so I leave a bag in the back seat and my car tells me that there's something on the back seat. So that's good, but people need to be reminded that, it can get very hot in a car very quickly. So pets,
Indeed.
children need to be paid attention to.
Absolutely. Yeah. That's sage advice.
Yeah. All right. Thank you, sir. We appreciate you once again chatting with us, and we'll see you next month for another episode. And thank you all for joining us and have a great day.
Great. Thank you, Rod.